Hi there, I'm Dr. Stuart Ort with ENT and Allergy Associates. I'm a neurotologist, which is an ear, nose, and throat doctor who specializes in diseases of the ear and ear surgery. I'd like to talk with you today a little bit about sudden sensorineural hearing loss, which is a condition where a patient will suddenly lose hearing in one ear, which may not recover without rapid treatment. Sudden hearing loss can strike at any time. It can occur in the middle of the day, or patients may first notice it when waking up in the morning. Most of the time, patients will feel a sensation of pressure in the same ear that they have the hearing loss, often like they're up in an airplane. Additionally, patients will frequently feel a sensation of ringing or humming or buzzing in the ear. We also call that tinnitus. Sometimes the sudden hearing loss will also be associated with a severe vertigo spell, which sometimes necessitates a trip to the hospital. Rarely do patients experience pain, although it does happen on occasion. If you experience a sudden hearing loss and it lasts only a few minutes and gets back to normal, really there's typically nothing to worry about. On the other hand, if the symptoms last more than a few minutes, and particularly if they last more than 24 hours, that's a cause for significant concern. You need to get in and see an ear, nose, and throat doctor right away, and you need to get a hearing test right away as well. Ideally, we'd like you to see the doctor within about 3 days of the initial onset, and if you wait more than 7 days before you start treatment, unfortunately your chances of recovery drop significantly. Now, when you see your ear, nose, and throat doctor, it's important that they take a look at your ear to make sure that there's no wax or debris in the ear canal, and also they want to check to make sure there's no fluid under the eardrum. If these are found, after they're cleared, in all likelihood your hearing will improve completely back to normal. On the other hand, if the ear is examined and it appears normal according to the doctor's view, this is a cause for much greater concern, as it is normal for the ear to look normal when you have a sudden hearing loss. So it's imperative that you get a hearing test right away. Make sure to insist on one even if your doctor doesn't specifically recommend it. If after your hearing test a sudden sensorineural hearing loss is discovered, it's critical that you start treatment right away. If you're not treated, only about 1 in 3 patients will get better on their own. On the other hand, if you are treated, a little more than 2/3 of people will see significant recovery. Now, the only treatment that's been shown in multiple scientific studies to be beneficial is steroids. The steroids can be given one of 2 ways, either by mouth, where patients start with a high dose initially and typically will taper off over 2 to 3 weeks. The other option for treatment is a steroid injection directly into the ear. Now, this may sound scary, but most patients don't find it particularly uncomfortable. Generally, the injections are given in a series, and that's typically split over the course of 2 to 3 weeks. If you do get an injection, you can actually drive home right away after your procedure, and there are no restrictions. You can take a shower without an earplug, you can even fly. The only thing we don't want you to do is submerge your head underwater like swimming. In conclusion, if you do suffer a sudden sensorineural hearing loss, it's extremely important that you get in to see an ear, nose, and throat doctor and get a hearing test in less than 7 days from the initial onset. And then you want to start treatment with steroids right away, either by mouth or through an ear canal injection. We at ENT and Allergy pride ourselves in getting patients in as soon as possible with our Call Us Today, See Us Today commitment. Thank you very much for your time.